Okay, we're going to discuss cluster 3, AT3. Okay, and this won't be due until after you've done your aged care placement. But what we want you to do is we want you to do the majority of it. So as I go through the requirements for this assessment task, I just want to make clear that you can actually start on this and populate most of it. And there's one aspect of one of the plans that needs to be done on placement in your second aged care placement, and then can be tidied up and finished at the end of placement. Okay, let's get going through it. So part 1 and part 2. So part 1, minimum 200 words, maximum 300. So you could split that between these two things that I'm going to ask you in questions 1, 2, 3, and 4. And how you set this out is up to you, as long as you fulfill all of the question requirements, okay? So question 1 saying, make a list of what you want to achieve during this course. What are your goals? In the 18 months you're here doing the nursing diploma course, what are your goals? Maybe make 4 of them. What are 4 goals you want to achieve, okay? And then we want you to think about on your second aged care placement here, what are 4 things you want to achieve in your aged care placement? Okay, what are 4 things you'd like to do? Okay, then we want you to prioritize these lists in order from the most important to the least important. Okay, so how you set this out is up to you. Okay, so we've got long-term goals of the whole course, and then we've got short-term goals of just on placement. And I think you should pick 4. So then that enables you to be able to prioritize them in a list, all right, as per question 3. All right. And then we want you to consider in question 4, make a list of the things that may stop you from achieving these goals or these objectives, and then develop some strategies that will help you to overcome these barriers. So what's your contingency plan? So an example, and please do not use this in your answers, an example might be, I would like to complete all 10 days of aged care placement, okay? So on your aged care placement, I would like to actually go and be present and marked off for all 10 days. And something that may stop me from achieving that goal might be sickness, or that I might be unwell, okay? And some strategies that you could use to overcome these barriers might be that you will go to bed early, you might take more vitamin C, you might do all varying amount of strategies you might do to not be unwell on placement. You might minimize your stresses that can deplete your immune system, by delegating tasks off to other members of your family, so on and so forth. So that's an example, but please don't use that one, okay? Then in part 2, this might be easier to just, the work by answering all the questions in these 2 grids, you will fulfill the word limit, okay? So you're required to do 2 plans, a personal development plan to guide you through the course and a work plan to use during placement, okay? So this might again seem a bit repetitive, so you might actually use some of the answers for up in part 1. You may use again in part 2. It's just putting it in a different format, okay? And we're remembering in part 1 we asked you about priorities in regards to these goals, and we asked you about barriers in achieving your goals. So this one is actually going to talk you through like a bit more of a time frame, and then you'll interact with your clinical facilitator on placement to also answer some of these questions. Okay, but essentially for part 2, let's just get into the grids that have been provided here for you. And essentially all you have to do for part 2 is fill out these. All right. So if I click on the first download, And here we've got a personal development plan, okay? So you've got, we want you to give us a goal, okay? Objectives to, and then part 2 here you can see what to achieve your overall goal, what are your short, medium and long-term ways you're going to achieve that goal, okay? So again, this is a personal development plan, and this is in relation to your overall broad perspective of the things you want to achieve in the course more broadly, or these could be professional goals. So how you envisage yourself in your future profession. There's no limit to what a personal development plan might be. Like we said in part 1, it was about what you want to achieve during your time at BFA and what you want to achieve on placement. So this might be just a little bit more of a professional overall goal, and then 3 different ways you'd like to achieve that. So if you actually have a broad goal of, this is my personal development plan. So when I was a nursing student, before I became a nursing student, my goal was to become a doctor of nursing. That's what I said in my interview to get into my bachelor degree. Clearly still on my track to doing that. No. So you could say that my broad long-term goal in nursing is to, like I said, for me, was to be do a doctorate in nursing. And so your short-term goal might be, I would like to do the enrolled nursing course at BFA Learning. My medium goal is to transition to my bachelor degree, and my long-term goal is to, do postgraduate studies. Okay. So then it's breaking it down for you to break it down a little bit more to make those goals a little bit more specific and measurable. So these are like making them into SMART goals. Okay. So tasks required to achieve your goals, and you need to list 3. So what are the things you need to do to achieve the goals that you've set yourself up here? Okay, and how will you know when you've achieved those goals? So enrolling in, VFA Learning nursing course, completion of graduation, from, and the achievement date might be, 18 months after 18 months after commencing the course, whichever cohort you commenced with, 18 months on from that, and then when you actually achieve this. So this is looking at making this an actual long-term plan. So this part here will not be populated, because this is actually for you to develop as your own personal development plan. So you'll populate these parts of when you think you want to achieve them, and then this will be up to you when you actually achieve them. If you've made your goals long-term past your time here at VFA, how will you know if you have achieved this goal? Okay, measure and achieved. So how will you know? And then whether you've achieved it or not. Contingency strategy, describe a time that something did not go to plan, and the contingency strategy that you had to put in place. So again, a goal that you've had in the past and that didn't go to plan, and what was the strategy that you used to help you, what have been your past contingency strategies, and that may be a strategy that you use again. Okay, so that's that. And then placement work plan 2. So the second one, placement work plan. So this is the one that you'll populate and complete once you get on placement. Okay, so these may be replicated from part 1. So you just list 2 objectives there, things that you want to achieve. Okay, and you'll also put objectives. this is something that is probably replicated across a variety of documents, okay? So you don't have to come up with new objectives. You probably already have some objectives, and you may put these objectives also in your placement logbook, all right? Okay, and what are the things you need to achieve that goal? What do you think you need to achieve that goal? So an example might be, on placement, I would like to care for a patient who has dementia from, because I don't know what somebody with dementia looks like and how to care for them. So I would like to care for somebody with dementia. The things you require, you probably need to ask somebody, can I be allocated to a patient with dementia? And so what you think needs to happen for you to achieve that goal. You might not know, but have a go. Have a go at what you think you might need to do to achieve that goal, and you might not work it out till placement. But then this is what this box is for. So how you thought you might achieve that goal is probably nothing, might be nothing like what the reality is on placement. But we want you to set a goal. We want you to think about how you might achieve it and talk to your clinical facilitator about those two things. And they might say to you, in our facility, we don't have any patients with dementia, so I don't think we'll be able to achieve that on this placement. And you just write that in there, okay? Or they might say, yep, we've got Mavis, Elsie, and Josie. They're 3 patients. You can take your pick, which one, and then you work out these time frames. And then you'll say, in week 2, you might set the date for week 2 here, and then you'll write the date that you looked after Elsie, and that's that. Those boxes completed. And again, here, so you might have multiple things for a goal. So even though there's multiple boxes, it might take, to achieve your goals of these 2 things, it might not be one thing that allows you to do that. There might be 2 different ways you can achieve that goal. So you write them there, and then you talk about it with your facilitator, and then you document here what your facilitator said about achieving those goals and whether they were possible or not. Okay. How will you know if you've achieved the goal? So again, this is SMART goals. So this is specific and measurable. How will you know? Elsie, I will have worked 8 hours with Elsie and provided all ADLs for her. I understood how difficult it is to communicate with somebody with dementia. This enriched my knowledge of caring for patients with dementia. And you might use these 2 boxes to explain those things. Contingency strategy might be, to achieve that goal, so if I can't look after somebody with dementia, I'd like to look after somebody with Parkinson's. Like, what's my backup plan if that's my goal and I can't achieve it? Again, what's your contingency plan? Well, my plan will be to change the type of patient that I want to look after. Reflection, so then that's just doing a reflection. Then again, we'd like you to use the model that you chose back in AT3. You've told us which reflection model you like using and why. So we'd like you to, here in 100 words, you might again just use the dot points from that reflection model and just make a statement of, next to every single part of that reflection model, you might make a statement about how you've reviewed your own work performance. Okay, list and describe a learning opportunity that you may use in an area where you feel improvement is required. So what would you like to do? What did you see? Was there something that you saw on placement that you think might actually help your learning, improve your learning? Okay, and that's it for AT3.